Hey guys, so here we go with the cardiovascular conditions today. Today is going to be one of those days where I'm just going to have to spend a little bit of time talking about anatomy and then what the actual conditions are, because it's going to be kind of like a terminology heavy lesson. And then in terms of what our counseling interventions are, they're relatively basic, but because cardiovascular conditions are so common and potential employers for all of you guys later on, this is something I want to cover in a little bit more detail. So I should have got my little clicker thing. And also, I moved around my microphone because I'm kind of trying to play with it to see what the best place to put it is. I haven't quite figured it out yet, so I'm gonna be fiddling with it quite a bit probably. Sorry if that's annoying. So as far as the basics here, let me talk just a little bit about anatomy. You guys have all seen this before. You've probably been through these lessons before, but the blood comes in through these two places from the body, right up here and right down here, and it goes into the left atrium. So the blood comes in here. Here's a valve. It's called the tricuspid valve. Then it goes up here back to the lungs because the deoxygenated blood comes in from the body because your cells have all used it up, and it comes into the heart. The heart gives it an extra boost as it's on its way to the lungs, fills up with air, and then comes back to the heart through these things over here. And then it goes back through here and it goes it pumps it again and goes out to the rest of the body. So that's just generally speaking what we have. We're going to talk about a couple things about an inner lining of the heart called the endocardium. Sorry, endocarditis is the condition of inflamed lining of the heart. There's also an outside lining that's out here, which you can't see it on this picture, but that's called the pericardium. Actually, we have those right here, these terms. Um, You'll hear a ton about pressure. We're not going to talk a lot about blood pressure and interventions, but you'll hear us talk about it. If you've ever gotten your blood pressure taken, you get two numbers. You get the diastolic pressure, which is the resting pressure, so how much pressure is in there between beats. And then after the contraction of the heart, it kind of increases pressure. Imagine like squeezing a balloon and you see the pressure increase in other parts of it. It's kind of like that. So we have those two. We're not going to talk a ton about those, but just to kind of know that that's what we're talking about. Your blood pressure then is your diastolic over systolic, and that's what the pressure basically means. We're also going to talk about the pacemaker, which is a pacemaker is both the term for, it's kind of the generic term for the thing in the heart that produces the electrical activity, but then you can put in an artificial one, which is a mechanical thing, which we'll get to a little bit later too. When it comes to the rhythms of the heart, here's some just basic terminology. We have tachycardia, which is just like a fast heartbeat. Then we have brachycardia, which is a slowed heartbeat. And then we have dysrhythmia, which is just an irregular heartbeat, which leads to atrial fibrillation, which is kind of like just a fluttering of the heart. And it's when the electrical system is kind of like out of whack. It just, is pumping in at different rates and that kind of thing. So that's just a little bit of language to talk about. Okay, let's get into all these different conditions. Excuse me. Atherosclerosis, which is a hard word for me to say. I know I fumbled through some words last week. But atherosclerosis, there's a lot of movements of the tongue in there. Atherosclerosis. It sounds kind of funny. Anyway, it's a condition of chronic inflammation due to too much lipid or fat, the bad kind of fats, in the arterial walls. We're going to be talking about all these different conditions of the veins and the heart. What we're talking about here is like when you have too much fat, it kind of clogs and restricts the blood flow. So this is going to be a theme we're going to be talking about throughout today. If you restrict the blood flow, either because of buildup of fats, it creates blockages, which then means that you can't get enough oxygen to the different parts of the body. So there's different conditions. In atherosclerosis, this is too much fat. There's also inflammation of the arteries or the veins, which lead to restriction too, but that's a different thing. So we're talking here about like too much fat. This is sort of like a dietary exercise kind of thing. If that happens, if there's a restriction in the veins, then if some of that fat or that just gunk stuff comes out, then the heart might not get enough oxygen, which leads to myocardial infarction or a heart attack, generically speaking. We'll talk more about that one too in a little bit. But either way, you get too much crap in the blood, which then can get stuck somewhere, We're going to talk about some more terminology there too. If you get stuff in the blood that doesn't belong there, that creates a problem. If you get stuff in the blood or restriction of oxygen, that's kind of one of the main conditions of a lot of this cardiovascular problem is just losing oxygen. So either something's there that shouldn't be, or you can't get enough oxygen. Those are kind of the two main themes of what we're going to be talking about. That buildup of lipid, that buildup of fat is called plaque. And that plaque accumulation, we usually we talk about that with our dentist about plaque on your teeth. It's just gunk. It's just like extra crud, which was fun. Somebody used that word crud the other day, and I hadn't heard that in like decades since I was a kid or something. So now I'm going to use it all the time because I think it's funny. So let's talk about what that crud is. We're going to use some generic medical terms. One of them is thrombus. So a buildup of lipid or fats is not the same as a blood clot, but they can both happen and they can both be something that gets in the way of blood flow. A thrombus is a firm mass of blood clot that's kind of stuck there. Imagine, there's actually a really good picture here. Right here. See down here at the bottom, this yellow stuff right there? So that yellow stuff, I was just looking to see what it actually said. The yellow stuff, this word right here that's probably way too small to read is plaque. That's a buildup of junk. So whether it's from lipids, whether it's that, fatty substance, or whether that's actually, go back here, whether that's actually a blood clot, usually due to some kind of infection, regardless of what that is, then it's going to block the way. So a thrombus is kind of a stuck, fixed blockage of blood flow. An embolus, on the other hand, is a piece of thrombus that travels through the bloodstream. So that's where we get into talking about if a piece of that comes off and then it goes through the heart and up to the brain, that could lead to a stroke. That's restricted oxygen in the brain. If it travels to the lungs, it's called a pulmonary embolus, which is restricted oxygen, or restricts the ability to move blood through there and pick up oxygen. So it's going to still restrict oxygen in the oxygen levels in the blood. So those terms are going to come up over and over again here. Thrombus, embolism. Remember that word ischemic attack? That means lack of oxygen. So ischemia is just reduced oxygen. It could be from an embolism. So this is where the terminology is going to get kind of confusing. I'm going to keep repeating this stuff to make sure we kind of just hear it over and over again so we can get used to it. Another term is necrosis. I'll try to not use that too much, but basically just means tissue death. So necrosis could be tissue death in the heart, which is a myocardial infarction when the heart doesn't get enough oxygen. It could be necrosis in a different part of the body where that other part of the body is not going to get enough oxygen. If an embolism detaches from a thrombus, here we go with the terms. If an embolism detaches from a thrombus, goes through the body and gets down to the leg, just for sake of example, your leg might feel kind of fatigued during exercise, which is a condition we'll talk about not too much later, but you can experience kind of pain, fatigue, tingling, that kind of thing in the leg, which might be due to a blockage of blood supply, i.e. oxygen. So that's what we're talking about when we say downstream issues, all right? Another condition is hypertension. So hypertension just basically means elevated blood pressure. If you hear that term, it means there's too much pressure in the system because the heart's working on overdrive, basically. By itself, that's not a big problem. But if it keeps working kind of in overdrive all the time, that could lead to problems later on. If you can think about it like a car that idles high, normally your car goes just sits there when you're not pressing on the gas. But if you've ever gotten in your car and it goes, it's just a system that's working too hard and it's just going to wear out faster. That's basically the general idea here. So hypertension can create long-term issues, but in and of itself, it's not necessarily the worst thing. One of the things we're going to talk about throughout today is what does that mean for our general lifestyle and sort of preventative measures of diet and exercise. We're going to say it over and over again. Diet and exercise are not only the part of the intervention, and which means lifestyle change essentially. It's not only the intervention for these conditions, but it's also the preventative message that we hear all throughout our lives. That if we take care of, get enough exercise and have a decent diet, and have a reduced stress lifestyle, that can help avoid this kind of stuff. But also, if you have hypertension, sure, there are medications you can take, but the role of a counselor is partially to help people figure out, okay, what is the balance I need to now make after this condition is diagnosed from a doctor? And then, of course, what does that mean for my working life and my family life and all that kind of stuff? So, anyway, back at it here. Um, I'm just going to skip over this because we're going to get to that over and over and over again. You're going to hear these same things. Maintain proper weight, diet and exercise, reduce alcohol and tobacco use, and there's just going to be like those general lifestyle things you'll see in just about every single one of these conditions that we talk about. One of the things that I'll mention now that we'll also hopefully bring up later is with a lot of these conditions, because so much emphasis is placed on the prevention of these kind of conditions, and also when something happens, like someone has a heart attack or whatever, doctors say, well, you're kind of asking for it when you're eating steaks every day and you don't get off the couch and you've now gained a bunch of weight and all that kind of stuff. By the way, my doctor, I lived in Billings for like 3 years. Last year, I went to a doctor to say, like, I don't really have anything to complain about. I just want to kind of establish a relationship here. And he goes, oh, well, then what do we talk about? And I was like, I don't know. What do you want to talk about? This is like more or less the conversation we had. And he's like, okay, well, let's just, let's do a little checkup. So he did a checkup and he's poking at my belly. And I know it's hard to see this, but I got a little dad bod. I put on a little weight from COVID and, having a desk job now as a professor and, going to school for years and all that kind of stuff. So I put on weight and I've exercised less than I used to. I'm just generally less healthy, which kind of happens when you're a student and you're, taking on a more sedentary work. So he said like, oh, you're getting too fat. You're at risk for things like heart disease and blah blah blah. This is the stuff he's talking about. My initial reaction was like, well, screw you. I'm not getting fat. Look at me. I'm fine. Everything's okay. But one of the parts about this is that if I don't really understand the seriousness of what this can lead to, and then decide to make some lifestyle changes to prevent these kind of things, I might just not be recognizing this until it's almost too late. In other words, I'm going to develop some other condition if I don't get my lifestyle in order and generally treat my body a little bit healthier. Of course, my mind as well. Reduce stress internally in terms of like how I feel about my relationships and my job and all that kind of stuff, and also externally, the kind of environment that I live in, at home and at work and all that kind of stuff. So I just want to mention that because we'll get into this later, but it's this is kind of the stuff we're talking about is management of internal and external stress and busyness, and then what we eat in our body and how we move it and all that kind of stuff. That's what we're generally talking about here. I'll just skip this vocational stuff because we'll get to that more in just a minute. Okay, more terminology. An aneurysm, most of us have probably heard of a brain aneurysm, which is just a popped blood vessel in the brain, which is a big, serious condition. But an aneurysm can actually be, it's more in a more generic sense. An aneurysm is just the dilation or ballooning of an arterial wall. If it's clogged, it might sort of spread out and build up pressure, just like a balloon that you're putting air in. It's going to dilate, right? With that, smoking is the biggest risk factor. Coronary artery disease is actually a narrowing of the coronary artery. So just to put a few things together here, I could build up plaque from lipids. I could get an inflamed artery that then restricts and turns into coronary artery disease as a result of something like atherosclerosis or something like that. So understanding the language here, you've probably heard a lot of these words, I'm guessing. Some of you may have. But if you haven't, excuse me again, if you haven't, it's not the worst thing in the world. But just part of what we're doing today is just trying to understand the language around cardiac rehabilitation and cardiac conditions and that kind of stuff. So another term, you may have heard in your past is angina pectoris, which basically just means chest pain. That's basically it. I don't know. This is again where I'm going to try and use some generic words, but I also want to use a lot of these medical terms because you probably will hear them, and knowing a little bit about what they mean and then what's the counseling intervention or vocational implications of that is going to be kind of helpful here. So here we go again with myocardial infarction is basically just a heart attack. And to speak about it in medical terms, what we're talking about is anoxia of the heart tissue due to total occlusion or blockage. Anoxia is just restriction of oxygen. Total occlusion or blockage of arteries. Basically, the heart suffocates. If I were to hold my breath and I'd be like, the heart just says, I can't get enough air and this hurts and then you eventually just, parts of it might die because it just can't get enough oxygen. So myocardial infarction, the heart attack, it's just a suffocation of the heart, more or less. So it can be caused by atherosclerosis, a stationary blood clot, a thrombus, as we just mentioned. It could be due to a floating blood clot, kind of comes through. Your valves are like this inside your atrium and ventricle, and it comes in, and if it blocks the valve from actually letting stuff through, it could be a floating blood clot too, not just restricted dilated veins, or arteries, I should say. Those blood clots can come from infections or foreign materials, such as those lipids that we were talking about earlier. And then again, the book keeps going over and over and over again. Lower your blood pressure, increase exercise, proper diet, quit using tobacco. You know, that message will be, we'll say that over and over again. This is one of the interesting things too. I'll just mention this as a side note. If you're sitting out there thinking, yeah, I smoke sometimes, I know it's not good, or I maybe eat too much pizza, or I don't exercise enough or whatever, you're probably going to start feeling, I'm going to guess here, you're going to feel a little bit guilty. It's going to start with a little bit of guilt. And then you might experience some of that denial of like, maybe it doesn't matter that much, right? Maybe it's, I should, but ugh. And then you get frustrated. And what your body and mind say, just put it out, put it aside. Don't take it seriously. Just whatever I can do to avoid the bad feelings that I'm feeling hearing about this stuff. And that's your body at work. That's your defense mechanisms applying themselves appropriately at the right time. The question is that what you want to be doing? Is that the lifestyle that you want to live? Or are you willing to take on the risk of the potential consequences later on? So what you might experience here, which is the same thing I experienced when my doctor was poking me in the belly, telling me I'm too fat, was everything in me just wanted to say like, you know what, screw you, which is, I use anger as a defense mechanism, right? Denial of like, he's just, all doctors are going to say that. Denial. Feel a little bit guilt. All those things that you might experience those when we're talking about this too, because of the way that these messages get either heard or ignored, depending. Okay. There are also congenital heart conditions. There's various kinds. There's more than just this, but septal defects. So some of you might have heard that term septum. Especially this part of your nose right under here in between, that's called the septum. It's just basically a divider, and your heart has a divider between your atrium and your ventricles. And if there's a hole and by the way, atrium, remember that's the blood coming in through the body that goes out to the heart and then back into the ventricles from the heart, from the lungs. Sorry, getting mixed up. Out to the lungs, comes back into the ventricles filled with oxygen, and then it gets pumped out to the body. If there's a hole in there, that means deoxygenated blood from the atrium is going through the ventricle and out to the body. It's just not getting enough oxygen. So there again, potential for tissue death. What a person's going to experience, maybe partially, is potential well, by the way, if there's a hole there, it needs immediate attention. So this is not something that's just going to happen. It's not like, an embolism dislodges and then goes through the blood and all of a sudden, okay, now I can't get enough oxygen and I've been living normally ever since. This is a different kind of condition. But if a person's not getting enough oxygen, depending on where it is, just generally over the course of their entire bloodstream, the condition of syncope or fainting, just like lightheadedness, generally speaking, probably heavy breathing, that kind of stuff. Anyway, so that's the septum. Um, Congenital narrowing of the aorta, which is just like, the pipes are too small for the pump. That's more or less how that works. And there's a thing called tetralogy of Fallow. I don't even really know what that means exactly, but it explains in the book. This is probably more specific than we want to get here in this chapter, but tetra is the Latin prefix meaning four. And it just means like there's these irregularities. There's four separate ones, and they kind of combine together to require their own diagnosis. It requires surgical intervention, probably like all of these do. So just know that there are sort of from birth conditions. It's not all behavioral and environmental and that kind of thing. We already kind of mentioned the inflammation conditions, but the endocarditis, that's the lining on the inside of the heart, or the pericarditis, either one of those can get inflamed. The endocardium and the pericardium, those are the actual, the sacs that basically surround or line the inside of the heart. The condition is called endocarditis, inflammation of the inner liner, or pericarditis, which is inflammation of the external liner. If those get infected, that can be painful and problematic. One of the reasons it can be painful is that infection then, like any infection, it inflames and then it can cause friction, and that friction is where some of the pain comes from. So if you've ever known anybody who's had painful, something happens that hurts in their chest and they know it's related to their heart, it can be really, really scary because people don't know if it means is this like a death? Is there a risk of death here, like at a heart attack? Or is this just something that's not, I need to exercise more, or do I need to take medications, or does this mean surgery? There's so many question marks because of the range of seriousness of these things that's part of what can be really hard for people to manage. Okay, peripheral vascular conditions. We're going to move away from the center of the heart here, and we're going to talk about peripheral conditions in the feet and the hands, and away from the middle part. Atherosclerosis, or clogging of the veins, can happen in peripheral veins too, not just in now I'm getting hung up on my terminology. Arteries. That's what I was going for. Arteries. Arteries are the big ones, and the veins are the small ones, just generically speaking. The veins in the end, or the peripheral, or the further away parts of our body, are going to be smaller, right? So if you have a big chunk of something that dislodges in your arteries and it goes all the way through your heart and it's now moving through your body, as those veins kind of get smaller and smaller towards your feet, those can clog as well. So if somebody is exercising and they experience, this is what I was talking about earlier, if they experience cramping and it reduces oxygen, that can be kind of it can cause a problem in a limb down here, which can then be pointed back towards the heart. And this is one of those things that doctors get to be like, you have a heart thing going on, even though you feel it in your foot, which can be kind of confusing to people if they don't understand the biology here. One of the confusing parts of this too, and you'll see in my note here, is that one of the things we think we have to do is say, okay, well, I need to increase exercise. That's the good thing. But if a person is exercising and they experience this kind of thing, what would you do if that were you? Probably say, okay, well, I need to sit down more. I need to avoid exercise because that creates this condition where I can't feel my leg or it hurts or something like that. So what we're doing here when it comes to counseling and behavioral interventions for cardiac rehabilitation, it's this weird delicate balance between depending on your condition, you may need to exercise more. Depending on your condition, you might need to exercise up to a certain level and then cut back. Understand what limitations you have. Depending on your condition, you might have to rest a little bit more. So it's really confusing for people when they're like, well, am I supposed to do it more or less? What's the deal? And we can tend to throw up our hands and just say you know what? Screw it. I've had enough of this prescribing me to do things. This is all too confusing. And it is confusing because of things like this. And so understanding a little of the biology, helping a person understand what's going on in their body, can help them understand okay, I understand now why I have to exercise more, but also within limits and in these certain conditions and that kind of stuff. So, thrombophlebitis. Thrombo means blood clot again. Phlebitis means inflammation of a vein. Varicose veins. I'll get out of the way when I'm talking here. Varicose veins. Probably we've all seen these. Many of us are familiar with what those are, especially if you've been around elderly populations, because this just kind of happens as you get older. But also if there are certain heart conditions or cardiovascular conditions, rather. When the blood can't efficiently be returned to the heart, distension or pushing out of the vein and congestion, a clog, occurs. So if you see the vein on the outside of a person's foot, for example, they usually happen in the feet because that's where efficiency problems happen. Blood can get pushed real well through areas that are close to the heart because there's a lot more pressure up here than there is down in your feet. But if the blood in your feet, like if your heart is either weakening or having some issues, if that heart isn't strong enough to push the blood through the feet, then that can cause problems. And it may not just be that the heart isn't strong enough per se, but it might be if you've for years I skateboard and I put a lot of impact and pressure on my feet, so I'm just expecting to have more of this happening as I age, just because the veins get like constricted and there's different things can happen to them just because of all the pressure and abuse essentially that I put them through. Okay, now let's get into treatment and management. This isn't going to take us too long, but I'm not going to say a lot about medications. There's 1,000,001 blood pressure medications and different ways to manage cholesterol and that kind of. By the way, that's a term we haven't talked about, cholesterol. In relation to atherosclerosis, there's the buildup of lipids or fatty stuff in your veins. That has to do with cholesterol, and there's good and bad cholesterols, and that's a subject for another day. But medications, I mean, somebody is getting rich off of this stuff because instead of changing our behavior and our lifestyle, we tend to wait until there's a problem. We eat all of our McDonald's and Taco Bell, and then we say like, wait a minute, I wasn't supposed to do that? What's the problem? And then we have to take medications because we're not living a sustainable lifestyle. Surgery. There are several kinds of surgery, and I have some pictures here to help us understand this. First of all, let's talk about stent, because this is the picture right here. A stent is just a physical, either it's like a metal or a mesh, could be plastic, different kind of materials, but it basically gets brought into the artery, and then it's left there so that if you have a constricted artery, it just like holds it open, more or less. So if there's, it could be for a congenital condition, it could be because somebody's has too much buildup of junk in there and they just have to like have that held open so they can get enough oxygen. Whatever the reason is, a stent like this one can be put into the artery. By the way, this is up here, this is somebody's finger. So we're talking like, that's probably about how big that thing is. The way those get put in is by a balloon angioplasty, and this isn't just a way to put in a stent, but it could also be just sort of a one-time, like, let's break up some of the junk in the veins, for lack of a better term. So the angioplasty gets, or the needle or the end of the thing, whatever the thing is called, they put in, it goes in through your leg usually in your femoral artery. The bone, if you remember that, called the femur, and your leg, the big one. Your femoral artery is a big vein that's kind of has a direct shot up to your heart. That's where blood is returned into the heart. And so it goes there. This balloon here has the stent around it, and it inflates and it pushes out the artery walls. So essentially, if you have that restricted movement, it can push it out, kind of open things up again. It's just like if you've ever know anything about plumbing and you have a plumber come over and you have a clogged pipe, and they stick a snake, that big thing down there, and they spin it around, they knock off all the crap on the walls of the pipes. Literally crap, no pun intended, but pun nonetheless. If they do that, then it sort of cleans out everything and you have a clean system. So that's what this is. They put a balloon in there and kind of expand it at different places. And a stent can be left in there to hold things open afterwards if needed. So that's basically what we're talking about there. The pacemaker, this is an electrical thing, an electrical device that gets put in there if there's some electrical issues. the heart has, it has to pump in rhythm. Most of us know this. Has to pump in rhythm, and it goes boom, 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 right? But if that rhythm gets disrupted, and you have that dysregularity or atrial fibrillation or whatever, it's usually like an electrical issue. So one thing that can happen is you can put in something that sets the pace, the pacemaker, so that there's not that irregularity. We'll talk a little bit more about that in a little bit too. Another thing that can happen is electrocardioversion for atrial fibrillation, which means it's kind of like, when they take those things, someone has like a heart issue and at a basketball game, and they take the things, go, and it shocks them, shocks their heart back into functioning. That's kind of what this is, only instead of like, a dead heart getting revived again, it's just sort of putting it back in rhythm, more or less. You can watch videos of like this stuff on YouTube, and it's just like you'll see a person, they put in some like anesthetics, and kind of put someone to sleep for just I don't know, like a minute. It doesn't even take that long. I think the medication that's typically used is propofol. And they fall asleep for a minute. They put the little sticky things on a person's heart, and it goes, and then they wake up a few seconds later, and the heart is back in rhythm. That's basically how that works. Okay, treatment and management. Another thing that can happen if the medications don't work, if the lifestyle changes don't work, if nothing else works, and there's a high risk, transplantation is an option. I don't want to talk too much about transplantation right now because it's a bigger topic than we really need to go into at this point. But there's a few interesting things about it that I think are worth mentioning. If you are a person who wants to, or in your future you find yourself working in any kind of cardiac rehabilitation facility, they hire psychologists and counselors and that kind of thing to do some of the assessment work. And basically, assessment is this really extensive evaluation on a person's physical health, which of course is not our job, it's the doctor's jobs. A person's physical health, their coping skills. Do they have adequate coping skills to be able to deal with all the stresses that go along with whether this is even an option for them? Do they have the capacity or ability to, excuse me again, capacity or ability to follow a rigorous management, lifestyle changes. We've talked about that lifestyle changes specifically when we're talking about diabetes. The way in which a person needs to change all of their behavior and manage activity and sort of forethink about all the things that are coming up in their lives. If they can do that, they might be a fit, but not everybody is. And so, and then also just like family dynamics. Is the family going to be supportive of this? Overall, it has to involve all areas of a person's life in order to say, hey, this is going to be expensive and it's high risk and all kinds of issues that go along with it. And so those assessments can be really intense. And of course, there's a lot at stake there. So with these high stakes evaluations, if you find yourself doing these kind of things, this is an assessment issue too. It's not only about, am I collecting all the information, but here's a person and probably family who are like, if I don't pass this evaluation, I'm not going to be accepted as a candidate for a heart transplant, which means my, it's life is on the line kind of thing. So they can be really, really challenging for people because of just the added stress of like, I've got to pass this. I've got to show that I'm a good candidate for it if I want to extend my life any longer. There is a 24-hour matching system because of the sensitivity of organs as they get taken out of one person and put into another. It has to happen quick and it has to happen really fast. So if a person is on this list for a transplant, if they passed all the evaluation stuff, they absolutely have to be ready at basically a moment's notice whenever a donor happens, which means probably if a person's a candidate for a heart transplant, this is true of a lot of different transplantations, you can't live in your country home up in northern Montana and then expect to, drive down to Billings on a moment's notice. And I don't even know if they do transplantations in Billings. I'm not sure at all. But nevertheless, you might have to relocate your entire life for a while or maybe like semi-permanently because it's not just a matter of during this intervention, but like think of all the pre-evaluations and the post-recovery and the doctor's visits and all that kind of stuff. So it's really common when people have issues like this, they just have to move to bigger cities or move to different places in order to live a lifestyle so they can manage their condition with the support of the medical community. So as a therapist, if you're working in more urban locations, you might run into people who are patients of rehabilitation like this. You'd be more likely to meet those kind of people. So anyway, it's like a huge disruption of overall life. And this whole chapter, we're talking about these things. Big disruptions in a person's overall lifestyle, up to and including where a person lives, and can I even live in my home that I maybe have lived in for decades, you know? So lots to consider there. Let's see. I think I'm gonna skip over most of this. The one thing I will mention, because I think it's kind of interesting, is that even though this is a pretty serious transplant, there's an 87.7% survival rate. I'm starting to get hung up on my, I can't read the screen right now, basically. As far as survival rates, that seems kind of high to me. Not too high, but it seems like a pretty high. And the book says, because of our advances in medicine, advances in science, and surgical technique or whatever that is, because of all these things, if you give, we talked about this in the cancer chapter, if you start the immunosuppressants and you say, okay, body, don't reject this organ, it's really important, you start that process, and then you put the organ in, and then the surgical intervention is probably a really big deal. I mean, imagine all the things you have to connect and make sure they connect well and then heal properly. That's a big deal. But then also, the way in which you chemically encourage the body to accept this foreign organ, and then over the next couple, days, weeks, or whatever, the medications and the medical advancement, medicine advancements to allow something like this to happen, I think is pretty amazing. And that number of 87.7 seems, it's almost, to me, it's a little bit mind blowing because that we can actually even do that. But anyway, also, things like this are just outrageously expensive. So when we're talking about like social equity and social justice kind of issues, it's not everybody that's going to be a candidate, and you can just probably guess who are the people that are going to be accepted and evaluated as being eligible for even this kind of thing. You have to have money. I didn't get a good sense of, I was just kind of did a quick Google search. I didn't get a good sense of the cost, but one estimate said it's well over $1 million for the first year. The medications required for immunosuppression and then follow-up just to like manage blood pressure and all that kind of stuff that has to go with it can be upwards of $2,500 a month. So just numbers like that to me are kind of staggering. And that's just, it's not $1 million over the course of a lifetime. That's for 1 year. So anyway, you can just imagine what that means for rehabilitation of different cultures and races and genders and all that kind of stuff. But anyway, let's talk a little bit more about the psychosocial interventions and that kind of thing. Now that we've covered a lot of that terminology, what does this actually mean for us and our job as counselors? So first of all, we've talked about all this like lifestyle and behavior modification, all this kind of stuff. And yes, as a counselor, I can do the same thing that everybody else does, which is say, well, you just have to, exercise and eat right. So make better decisions. Well, how do you do that? Person comes in, and for 45 minutes once a week, I say, well, how was your eating? How was your diet? And all that kind of stuff. And that's fine. But that's just sort of like banking on a person's willpower being strong enough and disciplined enough in order to make decisions. But if a person had that strong willpower and that discipline in their life, they would have just done that already. So how do I, as a counselor, then encourage somebody to say, okay, this is important enough for me? And also we can talk through all of the barriers. So I just want to mention some of the barriers here for just a second. One of them is a person's value set. When you think about the people you know in your life and the people around you, just generally in our culture, we live out our values in a way that expresses some really deep and important things. So the food that we eat is not just about sometimes it's about what's accessible. It's sort of an economic reality as part of our life, which matters. which means people don't necessarily always have choice. If you live in an urban environment and the only thing you can actually get is convenience store food, that's kind of, like you don't have necessarily the choice if you don't have any money to go to the local farmer's market and buy lettuce. You know what I mean? So there's an economic issue here too. Our cultural values of do we live in like ranch country of rural Montana where it's pretty acceptable probably to eat lots of steak and meat of different kinds. If you live down south, does your diet include tons of butter and starches and that kind of thing? All of those kind of things go play into what our values are. And especially if we have some of these other value issues of like, my family, we get together and our time of being a family where we really recognize each other is around meals. So food is more than just, an intake for calories and caloric intake so we can do other things in our life. That's like the mechanical purpose of eating. It's just to get enough calories so we can go do other things, right? But in terms of family values, if our family coheres around food or meal times, then that's one of those things that us as counselors, we have to say, well, how else can your family support you in meeting the emotional needs that families provide? So it's a value issue. When major family attachment is associated with rest, in other words, people go about their busy lives, some are at school, some are at work, whatever, and then we all get together at the end of the day and sit around the TV. If we just rest together, rest is an important thing, right? Like it has to happen, just like food. But if we overemphasize rest because we're meeting our attachment needs and our physical needs of rest, and maybe we're emphasizing our attachment needs over our physical needs, resting too much because this is where we love each other, then it's just a matter of prioritizing. So how do you encourage an entire family to get up and be active when they're like, well, if we're active, then we're not going to be doing it together because we don't exercise together. So then we're never going to fulfill our love buckets. I don't think that's a technical term, but love buckets is now something I'm going to say because it sounds fun. So those are two big things. It's like, okay, as counselors, we know a little bit about how people love and where they get their belongingness, right? Or we can. That's an opportunity we have. If a person gets their belongingness from food, rest, maybe there's a million and one different kinds of activities, but if those activities don't involve the thing a person needs for their management plan of a cardiac condition, then it's going to be really hard to get a person to say, well, you should no longer go watch, you should no longer get together and do this thing because it's going to put your heart at risk. And the whole family says, but that's what we do. That's our thing. That's what we love. And that's where values come in. That's where a counselor can really work with people to say, well, how do we help you express your value of family, of love and belonging in different ways than what we've been doing before, something like that. Another thing to consider too with regard to values is denial of limitations. So we have this like, in some areas of our culture, it's put up or shut up, pull yourself up by your bootstraps, just tough it out. Don't, this sort of stubborn denial of like, I just need to keep going. And that's an important defense mechanism. And this is not like I'm really trying to avoid sort of like liberal and conservative tropes here, but this idea that like life just goes on, you've got to continue on doing it, and don't stop, push through the pain. You have to perform as opposed to maintain quality of life. Some of these are just American values, and so shove down your emotions. Don't care what you think and feel. Just do the thing and keep going. This kind of attitude can lead to problems. I mean, it is a defense mechanism. It's also an important strategy to cope with stress and strain and difficulty in life. It can lead to things like overactivity. And of course, there's implications for adherence to a management plan. But if I just if I'm eating my Oreos for breakfast and then getting up and going to my high stress job, and all of a sudden I have this heart condition, and I'm like, well, but this is what I do. I've got to push through the pain. I've just got to deal with it. I'm not going to talk to no stinking doctor. That can create some problems, as you can imagine. So it's a value issue, right? As you meet someone and you say, well, you don't have you're allowed to make whatever choices you want. And I'm not going to be here to sort of like cram a bunch of stuff down your throat that you don't care about. Like my doctor who tells me I'm fat. I'm just kidding. I'm going to keep bringing this up. I'm really not upset about this, even though if it sounds like this guy's got some insecurities around his belly. It's really not that. I just think it's kind of funny. But if I'm going to be like any one of those other doctors or counselors or whatever, and someone comes into me and I'm like, well, I mean, you know what you're supposed to do. So I'm not going to sit here and preach at you telling you to do it, because that's me imposing my values on other people. We just don't do that, right? Leave that up to doctors. What we can do is we can say, okay, what is important to you? What matters to you? And how much does this diagnosis or prescription or enforcement of who you're supposed to be and how you're supposed to be different, how does that feel? Like, what's that all about? Do you actually want to listen to the doctors, but it's just hard to? Do you really not give a crap? And if so, then let's just like talk about quality of life and the rest of your life and how you're going to get the most out of it. Like we just get to say, you have the right to make choices. What can I do to help you in this project here? Of course, we want to encourage people to be healthy and happy and all that kind of stuff. But as counselors, our role is more to say, how do I help you get what you want? You now have this kind of requirement to live a little bit differently, but you also have all these really important things that you do. And I want to understand why they're important to you and then how we can express those within this new lifestyle. So this is part of what we're trying to figure out with people. And we can sit there and help other people, think of new ways to do things. But really, that's not terribly as helpful as much as if we can help a person work through and express the feelings of resentment and regret and guilt and all those kind of things, then we can get on to, okay, I'm ready to do this next part of the change process or something like that. So if you have been trained in motivational interviewing or something like that, and you've heard about the stages of change, you have the pre-contemplation stage where a person says, there's really nothing to worry about. I'm in denial. I don't have to care about this. And then we say, well, let's just talk about it for a little bit. Let's talk about what does this actually mean for you? Like, what parts of this make you so angry? I wouldn't like a doctor telling me what to do either, That's contemplation. We're now contemplating, moving on from pre-contemplation, we're now contemplating what is the thing that I'm supposed to be thinking about here, whether I like it or not. And then we move on to, application or action and that kind of stuff too. Is like, okay, now I've kind of worked through some of my emotions and thought about them and all that stuff. And now I'm ready to actually make some changes to my life. And we help support that process as well. But that happens on the client's timeline, not necessarily ours. We can hear the doctor's prescription of like, you need to do it at this time and this pace and all that kind of stuff. But then we help the client figure out like, where are the barriers, where are you going to get stuck? Okay. Anyway, back to this stuff. If my slides seem a little, okay, I'm not getting back to this stuff yet. I'm going to detour for just a second. If these slides at all seem kind of disorganized or unstructured, part of that is for a good reason. One of them is that this stuff is not even in the book. I'm adding all this extra. And I don't have a good resource to draw from that helps us structure this. So when we talk about like motivational interviewing, the stages of what this counseling intervention might look like, and we talk about, excuse me, what are all the values, or at least many of them, and how does attachment work in here? How does this fit? A lot of this stuff I'm just kind of making up based on the things that I know about these other areas, like, motivational interviewing interventions, plus attachment theory, plus some of the things that you might see in these cardiac rehabilitation centers or something. As a field, we just don't have this very structured or laid out yet. So if you're like, he just goes down all these tangents and it's all these random thoughts all over the place, it's because I'm trying to include as much as I can. And I haven't yet, in my experience and in my skill set, I haven't really fully developed how we formalize and really structure this kind of knowledge in a way that helps us learn it, and so that I can tell you guys of like, here are the things to look out for. Here's the theories that are going to be in use. Here's the interventions and what they might look like. I'm working on that, and that's kind of what I hope to do over the course of my career. But just generally speaking, as a field, we know that we're supposed to diet and exercise. We know a little bit about motivational interviewing, but that's a pretty new intervention strategy. We're learning about the stages of change. We're learning about attachments and how those apply to things like physical cardiac rehabilitation and not just child rearing and things like that. So, as my side note, if this feels unstructured and disorganized, it's because it is. I don't like it any more than you do, which is why, I'm still doing this job, so I can kind of figure out how to give better shape to this stuff. So anyway, that's a side note. All right. When a person experiences one of these conditions, I kind of alluded to this earlier, but there's a lot of fear and anxiety of the potential of future pain, the potential of death. I don't want anybody to restrict me, so as long as I just ignore going to the doctor, no one's going to tell me what to do. This kind of stuff. It can also, the fear and anxieties can also lead to self-destructive behaviors. Like, even though I'm supposed to reduce my alcohol consumption, if that's my primary coping strategy, I might just do more of that and say, well, I'm screwed anyway. I might as well enjoy myself. That kind of attitude. So these are also part of what counselors get to think about and talk to with other people. It's like, this is how you're coping, and that's okay. But is this how you want to cope? Is this ultimately going to get you to your end goal? And then, of course, all the interventions that are helpful for things like fear and anxiety. Think like phobias and generalized anxiety, and how do you manage your body conditions that are happening? Like, imagine if anybody's ever had like clinical anxiety, you felt that like the restriction in your chest and the pounding heartbeats and that kind of stuff. And then imagine someone saying, you have this heart condition, and you're like, oh my gosh, I'm going to die, which increases the anxiety, which increases your focus on your heart and all that kind of stuff. And so relaxation exercises and all those other interventions that work for those kind of things are probably going to be helpful here too. Like many of the conditions we've talked through the course of our semester, depression from isolation and reduced activity, kind of pulling away from people. I'm afraid to have sex. I'm afraid to go out and play baseball. I'm afraid to go walking with the ladies, whatever it is. Reduced social interaction and restricted movements and like getting out of the house, basically. Those put us at risk for depression too. Of course, as you can imagine, there's a huge family component here, and there's a couple things I want to highlight. One of them is, we've talked about resentment, being upset with somebody for not living a better life all through life, and now there's this. That's one thing. That's similar to a lot of other conditions. Another one is just role and function change. So a person, I'm the dad, I typically do this, I have this place in the family. Here's the mom, they typically have this role, this is their place in the family. Same with kids, grandparents, whatever it is. When something like this happens, those roles can change. They don't always, but they can change. And so adjusting and adapting to that new role change. If anybody is really interested in this kind of stuff, where you have a background in like marriage and family therapies, that kind of thing, those will be incredibly helpful in understanding family roles and how to adapt to them. Another thing that happens is that family members might get scared and want to sort of, I don't know the right word exactly, but like think of these two possibilities. In one case, let's say you have a husband and a wife. The husband has something happen and the wife is like, oh, well, now you can't take out the garbage and now I have to. And it's all because you made stupid decisions because you drank Coke every day for your entire life, and whiskey Coke, we'll just say that. So she's mad, right? Okay, that's one scenario. Another scenario is that this couple is very much in love and she's supportive and I want to help you and I want to do whatever I can for you. So I'm going to make sure that I just kind of hide all your whiskey and hide all the Coke and hide all the snacks because I don't want you to have them. In which case she's like making decisions for him, taking on the responsibility of his management when it really probably should be his. And so she might develop her own fears of like, oh, no, don't get up, I'll help you up. Oh, don't do that. And then she kind of like takes on her own condition as a caretaker for him, something like that. This can happen. Children can, take on anxieties of their parents if the parent has a heart condition. So there's all kinds of interesting responses from other people who are within that little subgroup. So there's more to talk about there too, but I'm not going to go further along into that discussion. Basically, what I'm saying is that the rehabilitation is a family affair, not just for the individual who's had this issue, because values are family and collectively owned. Okay, people can also have fear of losing their friends, losing their social standing. Like, I have a high stress, intense job, and now I have this heart condition. I'm told to reduce stress, but how do I continue to do the job that I have to be available in these high stress conditions? So if that means changing jobs or losing that position, I might lose some of that status or at least that vocational identity that I've grown accustomed to. And that can be a challenging thing for people to work through. Stress management. When we talk about things like fear and anxiety and depression, all that kind of stuff, we're talking about these internal conditions, right? Internalized stress from a clinical condition. That's the last bullet point down here. But there's also this environmental stuff. Like if my home life is just chaotic and there's all kinds of environmental stress in the relationships already, managing that stress and helping a family understand that some of the ways in which you're working are not going to work anymore. And if you continue down this road, it's going to be problematic. There's also like just taking on too much cultural drama from all kinds of other places. If you watch the news and you hear of all the wars and COVID and all the political unrest, or if that's your thing, that can be super stressful. If your thing is you're constantly on Instagram or Facebook or whatever your social media thing is, and there's all kinds of activity going on there, and you're consuming all of this busyness, and it just leads to like your head getting so full of it. It's stressful, right? So managing stress online, in person, what you consume and what you take in terms of like activity and what you pay attention to, all that stuff. So we're not just talking about food intake. We're not just talking about exercise expression, but we're also talking about what you put in your mind that feeds your soul, that kind of stuff too. It sometimes can be helpful, but also puts counselors in a high conflict position, which is why many of us don't like this. But if you're not comfortable with going into conflict situations, this stuff might be really challenging because you might have to go in and say, look, your family is full of conflict. Doesn't mean it's bad. Doesn't mean it doesn't work. I'm not saying anybody's dysfunctional here, but there's just so much energy and activity. And if all of you are internalizing that, particularly the person who just had a heart valve replacement, that could be potentially problematic and challenging. So maybe we have to talk about giving dad a little bit more rest or giving mom a little bit of time away or something like that. So this kind of goes along with all the family stuff, but stress management can be a big thing. If you are thinking, I'm going to go into counseling just so I can do some relaxation with people and, relaxation exercises, you can totally do that, and that's an important part of this. But if you neglect the outside environment, parts of people's lives, and aren't able to sort of potentially step into those places where it might feel really uncomfortable to, you might be missing an opportunity to affect something that's really kind of important and maybe detrimental to a person's overall condition or recovery. Okay, last, how we do on time? Oh, okay, this isn't too bad. Vocational considerations. Depending on what a person, this is gonna be really slim, by the way, too. If a person experiences things like syncope or is worried about, it's like just scared of like, what if my heart gets out of beat again and I experience that atrial fibrillation and all that kind of stuff? And what if I have a heart attack while I'm driving? Like that's a big bad deal, right? So driving restrictions might be required. It might also be required that you talk to somebody and say, look, I get that you're scared of this, but this is not an actual risk. Somebody might be more afraid than they actually need to be about their condition. And that's one of the really challenging parts about making good decisions based on good information. As you can imagine, if the heart is not working, either because of, think of all the things that could go wrong that we just talked about. Blood pressure, lack of oxygen, too much cholesterol, all that kind of stuff. Excessive physical functioning can really challenge a person, right? So when you lift something heavy, your blood pressure increases because you're like, and you're using a lot of muscles and a lot of oxygen and all that kind of stuff, right? So lifting, pushing, all that kind of stuff. That might have to be something a person takes into consideration. What often happens in situations like this is people are suggested to move towards more sedentary jobs. But as I kind of mentioned, when I took a sedentary job, it increased weight, which is also a risk factor for further complication. So it's this delicate balance between like, okay, how do you be physical and active? And is there a job where you can do that doesn't require these high exertion activities like lifting, pushing, whatever. Environmental considerations, cleanliness can be a big one because in a lot of these conditions, there's risk for bacterial infections. Something you might pick up if you read the chapter. Extreme temperatures like hot and cold, that can also be problematic. So that's something to consider. And also, if a person has a pacemaker, then working in certain electrical areas might potentially influence or interfere with the functioning of the pacemaker too. So that might be another consideration to make. There is probably a lot more here as far as vocational considerations, but the book doesn't really give us much. And without going too deep into it, I'm just going to kind of leave that there for now. Okay, I think, yeah, that's it. So thanks for being with me, and I will talk to you again in the next one. See you later.